On behalf of the Pharmaceutical Society of Sierra Leone, I'm Amara Bangali Sisi Doctor, the pharmacist and the second vice president for the society. So I welcome each and every one of you to this very, very important event. Looking at the current situation globally, so I think this is one of the things that we have thought as a society where we can bring together members across the world, pharmacists, non-pharmacists, healthcare professionals across the world, to gather together and update ourselves in ways that we can strengthen supply chain to prepare for vaccines, more specifically COVID-19 vaccines. Then also to actually ensure that as a country we are in partnership with key people that are very much important to ensure that capacity building of healthcare professionals, including pharmacists, is on the way. So I welcome you all very much. From our side here in Sierra Leone, we have very key people. Dr. Sati Kane, the Deputy Chief Medical Officer from the Ministry of Health and Sanitation, is standing by to do the official launching, and also members of the panel and executive, national executive members of the Pharmaceutical Society. We are all here, set and ready to kickstart the process. So thank you very much, all of you, for joining from Sierra Leone and outside of Sierra Leone. So I hope we all have a very fruitful deliberation. So we go next to the next item in the agenda. So I would like Dr. Eugene Ponte, who is the Secretary General for the Pharmaceutical Society of Sierra Leone, who has been leading this effort in the beginning to ensure that this partnership comes to a reality. He's here to tell us a few things about what, giving us background into the partnership and what PSSL has done so far since the start of the exchange of emails and negotiations with regards to this partnership. Dr. Ponte, over to you, sir.
Good morning, everybody. The PSSL is a non-profit professional organization of pharmacy professionals that has as one of its mandates to contribute to the body of knowledge and promotion of pharmacy education. In that vein, that is why the collaboration with Empower, a go-ahead academic research and consulting institution that promotes universal access to health and education. Empower is an accredited organization with a wide range of international recognition and partners. I first encountered Empower in August 2020 through one of their ambassadors, pharmacist Veronica Lin. When I was introduced by her to Empower, I then went further to inquire about Empower. I found out that Empower had an extensive experience working on projects related to digital learning, digitalization of content, procurement and supply chain of pharmaceutical products, access to medicines, quality and regulation. In that sense, I found it that it would be useful, that Empower would be a very useful partner for us. I then encountered our director of my executive, and since August, we have been having a number of meetings, Zoom meetings with all of the executive members, and that is what has culminated into us going into an MOU with Empower, a contract, and that is what has brought us here today. So I want to say, after 6 months of the encounter, this is where we are to now formally launch the partnership, and then now all the time to Empower and time to everybody who is joining in, so we can now that is all how we encounter with Empower.
Okay, thank you very much, Dr. Eugene Ponte. I think your summary has been very insightful of how far we have come between Pharmaceutical Society and Empower School of Health. So I will ask Rahul to also give a brief background from the Empower side. Over to you, Rahul.
Yeah, thank you so much, Dr. Amara. And I'm first of all thankful to all the Pharmaceutical Society Sierra Leone members, esteemed guests, esteemed speakers, moderators who are now a part of this event. It's a very good day that Empower and Pharmaceutical Society Sierra Leone have joined hands. There is a partnership, and I'm thankful to Dr. Eugene Conte, Veronica, who initiated this discussion, and to Professor Murtada Sese for accepting our request and getting this partnership. Just as an introduction to about Empower Group is basically a public health focused digital learning and capacity building organization that has almost supported clients in the e-learning community from across 100 plus countries, primarily in Africa and Asia, and specifically in the field of global health, education, and humanitarian programs. So basically, we have got an extensive experience to work on various projects, digital learning, digitization of content, as told by Professor Conte. We work a lot on supply chain management. We work on access to medicines, quality, and regulatory frameworks. We work with Ministry of Health all across Africa and Asia to ensure that we are able to strengthen pharmacy profession. So I am very much thankful to everyone for joining the webinar, and over to you, Dr. Amara. That's all from my side.
Thank you very much, Rahul. Thank you very much, Rahul. So we look forward to a very good partnership between Empower and Pharmaceutical Society of Sierra Leone. So I now have the honor and pleasure to invite the Deputy Chief Medical Officer, Dr. Sati Kane, who is one of our very finest in the Ministry of Health and Sanitation. And luckily, he is here with us, so we are very pleased about that. So he will do the official launching for us. So over to you, Dr. Kene. Thank you for coming and welcome.
Yes, thank you very much, Dr. Amara. Well, I want to take this opportunity on behalf of the leadership of the Ministry of Health and Sanitation to congratulate the Pharmacy Society of Sierra Leone, the president and team, for actually such a laudable, gesture and partnership, and this is all within the drive of the government of the country to really see that we improve on the human capital development. And I see this is geared towards that. So thank you very much. And I'm elated to really be part of you to launch this partnership. Everything we do in the Ministry of Health and Sanitation or in the health sector, we cannot do it well, or it is never going to yield a dividend if you take away the pharmacy and the pharmaceutical products also. So the reality is, whatever we do, we need the system, we need the commodities, we need the professionals to really help in everything, because you can diagnose, you can say, prescribe, but if it is not there, if you don't have the technical people to really ensure that the things go right, the patients are not going to get well. We will not get the system. So as normally people say, without the products, there's really no program, And talking about the commodity management, you also look at the human beings and the products themselves. And of course, that cuts across a whole range of things, from the product itself, the production, to the supply chain. You talk about the regulation, and I'm happy that this partnership will look into that, research the community themselves, because we cannot work again always in the health sector, only in the health facilities. We have to have the community buying, the way they use the drugs, and especially in our country where poverty and illiteracy is there. So the misuse of these products are high. So how we interface with the community and how we regulate, how we talk about the rational use of these things are very, very important. But in all this midst, I think as the Ministry of Health and Sanitation, we will be very, very happy when you have the capacity to really strengthen the supply chain management of our commodities. And when you talk about quality assurance and research, if those things can really be strengthened within this partnership, and then to really build capacity, as a ministry, we will be very, very, very happy. We we all know that no matter what, you have to have a very good supply chain system. And of course, we know where that starts. It actually starts from even the forecasting, or maybe it may not be where, but you have to forecast well. You understand, when you forecast, then you can quantify, then you put in your procurement procedures. Then it also has to be with the products, the quality of the products, how it transports to the system, how it comes to the country, how is it to the very last mile. You understand? But that is the one-off. It also needs the whole management of it, the person managing it over there. How does they understand? How do they know that the thing is there? So it's about having the right quantity of drugs, the right drugs at the right time. Always do everybody within the system understand that management, the threshold at which you have to request. So this really tells you that we need a volume of professionals, more the pharmaceutical people, to be in everywhere. Of course, the storage of it. How do we store these things, which is very, 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 very important, be it the drugs, the vaccines, and all these things have to be looked into. And I would let you know that this is the area that has been weak a bit. We have the professionals. They are very good, but they are not everywhere. And over the years, they are trying their best, and we've got a lot coming up now. The trainings are coming up, so we are getting more and more. But we need more. So this, given that this is a capacity building partnership, we will be very happy to see how our pharmaceutical staff team will be increased in quantity and in quality. And as we go, because there's need everywhere, we will know we will bring on board all other people. And since that's ever since, even before Ebola, we have been having such problems. We have the stuff, we may have the commodity, but they may not be where they are supposed to be. And we all know, for example, if the missed opportunities we get when the women take their children for vaccination, for example, and they are not there. These are irreparable things we lose when these things happen. For example, you get a patient, you diagnose, the drugs are not available, or maybe it is too much in one place. So we really we'll be very happy to really see how this thing can work. And I'm happy that we will be investing in the training of more professionals, more people to come on board. But I wouldn't really want you to limit it only to the pharmacy professionals. As you know, as it is now in our country, it will be fine if we have all the pharmacists handling the commodities, be it vaccines or drugs. And of course, over the years, we've realized this, because initially we had only pharmacists in hospitals and then in the unit here. But at least on every program now, we've ensured that we have pharmacists there, because we know that commodity management, the keeping, the storage, the forecasting, especially the logistic management information system, is very, very key, and they understand it very well. But then still, for example, if I look at my own profession, my own area, reproductive and child health, there are midwives that handle oxytocin. They handle carbitocin. We may not have pharmacists everywhere. We need to store these things on the cold chain. Do they understand all that, the storage facility? So I will appeal that this opportunity, this platform will not only be limited to the higher level professionals, but we will see how we can extend it to other cadre of staff that actually handle commodities, like the laboratory people. The laboratory reagent management and other commodity management is all falls under supply chain. How do the midwives handle the drugs that they directly control when there are no pharmacists? Like the oxytocin I told you, like the nevirapine when they give back to the child, that it is always available, that it is kept in a place where the potency is not disturbed. So we as ministry will look forward to really see how this partnership will improve on the systems, improve on our functionality, and improve overall on the healthcare delivery system, that we see that people, women and children, and even adults, because we always leave adults, especially men, we leave them out. But this time, including the men, we'll really live our lives well and going forward. So we'll be knocking at the doors of Pharmacy Society Sierra Leone as a ministry to really see that they match and then do match up to our needs and provide our needs, and we hope the Empowers partnership will help us do this. So with this now, I have the singular honor on behalf of the Chief Medical Officer, my boss, to launch this partnership and to announce that there is even now one free scholarship and 5 partial scholarship, which we are very, very grateful, because this is all improving this country, the ability to respond to our people. So I thank you very much.
Thank you very much, Dr. Kenneth. You have said it all. Thank you very much. Just so we move quickly. And so now we have come to the end of the launching of the partnership. I implore participants to stay glued to their devices as we now enter into the webinar session proper. So Rahul, that's it from my side. So we go into the webinar.
Thank you so much, Dr. Amara, and thank you for the launch session. It was quite insightful. Good to hear so much good words from the team. So we now move ahead. Sonia, can you please move on the next slide, please? Dear all participants, stay tuned and we are starting the webinar. So as you all know that we have all gathered today for this webinar, which focuses on strengthening immunization. Basically, we are going to talk about supply chain management and preparing ourselves for the COVID-19 vaccines. And so we have various esteemed panelists and moderators with us. So next slide, please. So there are a few housekeeping announcements for all of us. Please kindly mute your mic and turn off your video if you are not presenting. And if you are a participant, please ask questions using chat box and raising your hands. Better to write in chat box. Please participate in poll, which is going to happen in between to help us all engaged and know more about your interest. And we will be sharing the webinar recordings. And this will be available on our YouTube channel, the Empower School of Health YouTube channel. The slide deck will be shared with all, and you can move ahead with the next slide, please. We have a feedback also. And other things for the speakers is that please turn on your camera for better engagement. Please mute your microphone when others are speaking, and let's all adhere to the webinar scheduled timings, because we have some timings which are associated with each speakers. Next slide, please. So as I said, and as said by Pharmaceutical Society Sierra Leone team, that the main objective of this webinar is basically to help the participants to understand the importance of supply chain management issues, and specifically pertaining to immunization, and specifically focusing on COVID-19 vaccines, as everyone knows that the pandemic is happening. Next slide. So I hand over to Veronica. Veronica and Professor Gage will be our moderators for webinar. So over to you, Veronica, first of all. And before that, I would like to introduce you. And that is that Veronica is an alumni of Empower's postgraduate diploma in procurement and supply chain management, and represent us as a country ambassador for Sierra Leone. She is a well-experienced pharmacist with a demonstrated history of working in the industry. She is skilled in pharmacy, forecasting and quantification and management, having strong healthcare services background, and graduated from College of Medicine and Allied Health Sciences, Freetown. Over to you, Veronica, and I will request you to, introduce Professor Gage. Sorry.
Good morning and welcome to the webinar. Professor Gage is a chairman of the Polio Certification Committee, and is a former head of the Department of Community Health in the College of Medicine and Allied Health Sciences. He's a former registrar of the Medical and Dental Council of Sierra Leone. He's currently the chairman of the Polio Certification Committee, the chairman NITAG. He has had medical and public health training in Germany, England, and Canada. And he's worked as a consultant for the World Health Organization in several countries, including Lesotho, Malawi, and Ethiopia.
Thank you, Veronica, and thank you, Professor Gage. And here we are with our first poll. Professor Andy, can you take us through how does it work?
Okay, I hope now you can see on your screen the poll. If you will please try to answer the questions on the screen. These are general questions. We don't record your individual responses. We only record the overall group response. So please make your votes on the screen now that you can see. I see we have 125 people, so we need at least 100 people to vote to give us, and we do change and modify the course according to the results we get in the polls. So we need more than 100 of you to vote in the poll. Please go ahead and vote now. You can see the results on the screen as we go ahead. This first poll is just general questions. As we get further along in the webinar, we'll ask more specific and technical questions. This helps us just achieve the balance and the way to go about the level in the webinar. Okay, so we're up at 50 already, excellent. And I see we have a wide range of people, and we also have a considerable number, 17% from outside Africa with us today. And we have most people at bachelor's and master's level 1 education. And of course, the majority of people are pharmacists. And the majority are working in public sector government bodies. Let's just take it up past the 100 mark if we can, please, and then. I see that we have a question. We have no East Africa in the poll. No, we don't. We didn't expect anyone. If you count yourself as West Africa for today, please. We'll make sure we modify that for future ones. And just coming up past 90, just a few more votes, please, and then we can stop and just take a minute to look at. Okay. Okay, just a few more to vote, please. No, we're not operating in French today. I'm sorry. We do operate courses in French language, but today is only an English language course. If you want a French language webinar, look at the Empower website. You'll see the French language webinars posted. We don't operate dual language. It's just too complex in the short time that we have for a webinar. Okay, more than 70% of you have voted. That's good. Majority are male, okay, and you're in the 30 to 40 age group, so most of you are experienced and practicing for some time. Of course, the majority are from Sierra Leone, but with significant inputs from rest of West Africa and from other regions. Okay. Most of you are bachelor's and master's qualified, so we have quite a high qualification, so I'll go through the technical content quite fast today. And of course, most of you, as we would expect, are pharmacists and a good selection of supply chain management staff. A majority are working in the public sector. Okay, thank you very much for completing that poll. I'll hand back to you, Raul, as we move along.
Thank you, Professor Andy. And now I hand it over to Dr. Amara to take care of this slides, please.
Yeah, thank you very much, Raul. So just to tell our participants more about the Pharmaceutical Society of Sierra Leone, who we are, what we do. And the Pharmaceutical Society was founded in 1978. It has been a long time. And our aim and vision is that we discharge its functions to the Secretary General, who runs the day-to-day business of the society, but under the supervision of the president, who is the overall overseer of the activities of society. We have a treasurer who oversees the finances of the society, and we have one full-time employee who is the secretary, and we want to thank her for her services she has rendered to the society, an administrative assistant, and also an office assistant. This is just briefly what the society is. Next slide, please.
Next slide.
And this is the national executive of the Pharmaceutical Society of Sierra Leone. This is the body that is running the affairs of the society. You can see a very handsome man smiling at the left. He is the president of the society, Alhaji Mutara MCC, who has no doubt steered the stewardship of the society for 5, 6 years now. So, and also the vice president one, Dr. Michael Ahai, the second vice president, my able self, and the secretary general, Eugene Conte, the assistant secretary general, Tambasakwi, financial secretary, Alpanti Jankela, and our pharmacist rep, who is representing pharmacy affairs in the pharmacy board, Tamimu Kalon, and pharmacy technician rep, Emmanuel J. Kalon, and our able treasurer, Marie Kolifa Kamara, editor-in-chief, who is also responsible for our magazines and all those information that we put, and our PR editor-in-chief, Sano Boake Kenewa, and our PRO, Alusine A. Musa. So this is the executive of the society. Next slide, please. Now, quickly about the membership. So the society is a very big community, group of pharmacy professionals, both practicing in Sierra Leone and outside of Sierra Leone, but one way or the other practice in Sierra Leone at some point. Currently, we have a total number of 351 pharmacists and a total number of 759, 579 pharmacy technicians. So it's interesting to know that it's a statutory requirement to be a member of the society before you can be registered and practice. It is by law. It's not a voluntary issue for you to be a member of the society. By law, if you want to practice pharmacy, you have to be a member of the society before you can be registered to practice. So pharmacists and pharmacy technicians will have the chance or the opportunity to practice pharmacy inside and outside of Sierra Leone. So becoming a member will give you that opportunity to practice pharmacy and pharmacy-related activities within and outside Sierra Leone. We have had instances where we provided information or updates to colleagues who traveled out of Sierra Leone so they can be registered and practice as pharmacy professionals. So that is some of the benefits that you can benefit as a member. Thank you very much, Raul, for finding out.
Yeah, thank you so much, Dr. Amara. And now I'll take all the participants I'll tell about Empower School of Health in brief so that everybody is aware about the Empower School of Health. So basically we are based in Geneva. We have offices in New Delhi, Dhaka, Nairobi, Kathmandu, Bangkok, Harare, and our vision, as it says, is transforming the way people learn, work, and save lives. Next slide. So in terms of our company profile, if you see that we are at present working in almost 100 countries with various multiple languages. We work in Francophone, we work in Anglophone countries in Africa, and our main aim is to strengthen the HR capacity of global health and humanitarian programs through online courses and training and capacity building workshops. And in fact, Empower has already delivered 1 million hours of capacity building content to nearly almost 200,000 public health professionals globally. And on the right hand side, you can see our clients, which are basically some UN agencies like UNDP, UNOPS, UNAIDS. We have worked with various Ministry of Health, specifically like in India and in Asia and in Africa. We have worked with Zimbabwe, Rwanda, Kenya, Uganda, to name a few. And almost we have some good private sector partners as well, like Johnson & Johnson, MSH, the Union, Save the Children, to name a few. Oh, next slide, please. And if you see on the globe, on the map, we are present heavily, and specifically if you see, we are majorly almost in 40 countries in Africa, where we have tie-ups with international NGOs, regulatory bodies, industry associations, Ministry of Health, various universities, and pharmaceutical societies and councils all across Africa, Asia. And now we are very much fortunate that we have now hands-on with Pharmaceutical Society of Sierra Leone, which you can see in the map. We have now put it in, and we are very glad to be associated with the team. Next slide, please. So in terms of the areas of focus, we have mainly three focus areas where we work with. One is leadership and change management, digital learning, procurement and supply chain management. Based, and in these focus areas, we have various domain areas. On the left hand side, if you see, we work in global health leadership, health supply chain, specifically focusing on COVID-19, HIV, TB, malaria, nutrition, MCH, AMR. We work on various new product development and introduction in various developing countries. We work on medical lab diagnostic trainings, and main aim is to ensure there is a health care workforce strengthening, specifically, pharmacists firstly, then lab technicians, supply chain professionals, and nurses also we are looking at. And we have got two schools. You can see on the right hand side the Center for Digital Learning, which is based in Geneva, and we have a Center for Leadership Development, which is also there in Geneva. And we have various offices all across the world through which we operate and provide digital learning and courses to the professionals. Next slide, please. This is the framework generally we work on. Like I told you that in terms of health system stakeholders, we work with national and provincial governments, donors, academia, technical institutions. And then our main aim is to see that healthcare systems strengthen. And for that, we work on various technologies. We work on developing e-health courses. We work on healthcare financing, having courses in leadership development. And main aim is to help in increasing quality, affordability, accessibility, acceptability, and availability of all these courses, as well as ensuring that the people are trained and they improve the healthcare systems in their country. Next slide. These are a few of our advisors and faculty members, and Professor Andy Barklaw is here with us today. You can see him, and we are very much inspired by Honorary Excellence John Kufuor, who was a former president of Ghana, who is our mentor. Through him, empowered team, generally, we get various ideas. We work in Asia, Africa on his mentorship. And then we have our Professor Paul S. Lalwani, who's our director. Dr. Denny Brown is our director based in Geneva, and other faculty members you can see all across the globe who are working with us and ensuring capacity building of healthcare professionals globally. Next slide. Again, next slide, please. This is what we have discussed. And now, why Empower is unique is that we have a team of people who work in various domains like supply chain, e-learning, digital learning, capacity building, public health, and disease focus experts. We do a lot of e-learning technology and training. Specifically, as I told you, in over 20 languages all across the globe. And we have these funders and partners, which I told you earlier. Next slide, please. And as we have already tied up with Pharmaceutical Society Sierra Leone, we are offering these courses to the members. These are our courses which are available online. We have masters, which is under development in global health procurement and supply chain management. Then we are actually running right now postgraduate diploma in Psm, and which is like in partner with Kent State University, USA. And then we have various diploma and certificate courses. So anyone interested to know what are the kind of courses we have, they can log in to Pharmaceutical Society Sierra Leone website. We have a web page. You can click in and learn more about it, or you can Google Empower School of Health and come to our website, or write to us. We'll send you the prospectus. Next slide, please. So here we are, Professor Andy, with the poll 2 for the participants.
Okay, we ask you once again, please, to undertake the polling. These are slightly more focused questions. One answer for each question, please. Firstly, have you ever dealt with immunization programs before? Have you had any training or education, and we mean specific to immunization programs? Public health emergencies, such as the COVID pandemic that we're experiencing at present. Again, specific training to handle public health disasters and emergencies, rather than just generalized training. And finally, at what level are you working in the organization? Technical, managerial, or leadership and governance? You see, oh, very fast polling this time. We're already past 50. Excellent. And I see we have a lot of experience in immunization programs, already over 50%. Good. And some training in immunization programs. So we've got a fair amount of experience and some training, but a significant number with no specific training in immunization. For public health emergencies are very good, over 60%, excellent. And I see mostly are working in technical sections with a fair number of managerial staff as well. Okay, and just go for up to the 2-minute point and then stop. Okay, we can stop the poll in there. We're over 100, okay. So I think the main point is we have a very experienced group today, which means I can undertake the technical content very fast and move through into more advanced areas. Thank you very much for polling. We'll have more polls shortly. Okay, we can stop the polling now and move on, please.
So I will now request our esteemed president, Professor Alhaji Murtada M. Sese, which is our panelist. He has been appointed the Managing Director, Health System Supply, and the President of Pharmaceutical Society of Sierra Leone. He had already spent around 7 years as programming and policy analyst at the global health level. He worked as a senior procurement and supply chain officer with UNOPS for 12 years, and he has also worked as technical officer for UNICEF Supply Division for 6 years. I welcome you, Professor Murtada M. Sese, for your kind words. Next slide, please. Over to you, Professor Sese.
Yes, please go ahead. Thank you very much. I think I have to come in here because according to our own program schedule, Gate should introduce Professor Murtada Sese, and okay. I wouldn't miss that opportunity.
Yeah, please do that. Please do that. I'm sorry, I came in between.
It's all right. But before I do that, I will shift it a little backward because of two reasons. Firstly, it's well known and you've done something about it already. And secondly, it's quite a modest man who doesn't like to be shouted about all the time. But let me start by thanking all of you, welcoming our participants, our colleagues, the Pharmaceutical Society of Sierra Leone and Empower of India and Geneva. Okay, I thank you for the opportunity given me to be a part of these proceedings. And I want to congratulate you very much for this adventure. In all my years in the Ministry of Health and in the field of medicine in Sierra Leone, this is the first experience I've got of such a project being launched. And I hope the other professional bodies will really follow the lead of pharmaceutical society. So I congratulate them, and I congratulate you also on the other side for the support. We hope to see this venture grow from strength to strength. I notice also that the topic of immunization has been chosen for this particular occasion. This is very much in keeping with the United Nations' third strategic development, that is of improving lives, making life better, and improving the lives of people of all ages. We have got a lot of experiences as far as immunization is contained in Sierra, is concerned in Sierra. We recall, if we go a bit backward, how immunization wiped out polio, and coming nearer, it has got a number of diseases under either eradicated or under control. Just to mention them, the childhood diseases, whooping cough, measles, neonatal tetanus, and more recently, we are now thinking about diseases for the emerging diseases like COVID-19, and also more recently, I should mention that also, that we succeeded in eradicating wild poliovirus. So these are the effects of immunization, and I think it is very appropriate that you decided to select immunization as your topic for this presentation. Chain supply and management, these are critical issues. Earlier, Dr. Sati Kano, our Deputy Chief Medical Officer in the Ministry, has stressed the importance of these things. And now, our next presenter, Mr. Dr. Mutada Sise, will be talking about chain management. As you said, he is the president of the Pharmaceutical Society of Sierra Leone, a job that is ably done, undertaken for the past 7 years, I understand. He is also the chairman of the National Medical Supply Agencies. So we take his word as the be-all and the end-all when it comes to supplies. I believe he says everything that is right. Even when it's not right, I have the feeling that it's always right. We must take him as right. So with that short introduction and short statement, I would like to hand over the microphone now to Dr. Mutada Sise.
Okay, thank you very much, Professor Gage. It is a pleasure to have the opportunity to participate today. And I want to say, first of all, it might be surprising, or one may wonder why I chose to look at history. And the reason is that I started preparing this presentation with an inquiry in mind. Why is it that, especially in the area of supply chain, every time we have an emergency, we seem to go back to square one, at least in my experience working in various developing countries. And so I went back to the records to see that since Jenner's discovery of the smallpox vaccine, the issues surrounding immunization have always been the same. It has been always to do with human resources. It has been always due to research and findings, to do with financing. So why is it that we have to go back to square one? This is why I decided to start with a historical perspective. And this is true even with COVID-19. People have already started looking at things that should be in place. So if I start in that regard, that is the background. In fact, also the issue that immunization has always been of value. And I say here in this slide that if you ask a public health professional to give you among 10 lists of issues, immunization almost certainly will be on the top, if not, yeah. So why are we still having problems 3 centuries later? So I just wanted to give a background to why I started with a historical perspective. Let us not throw the baby with the bathwater. There is a lot of experience, a lot of things already in place. Let us give time for them to move on upon. The objective, of course, as we may know, is that immunization supply chains seek to ensure that the vaccines are safe. Now, oh, sorry. Next slide then.
Okay.
Yeah. Okay. Yeah. The objective is assuming now that we have established this value for immunization. What do we try to seek? We try to seek that vaccines stay safe and effective and reach the beneficiaries who need them in a timely manner. This is very uncontroversial, and everybody tries to work towards that. Well, how do we achieve this? As I said earlier, since Jenner's time, it has been through human resources. It has been based on a solid infrastructure. It may change from time to time, it may improve, but the infrastructure is important. And by that I mean the supplies, warehousing, the cold chain equipment, vehicular fleet as to how you move things from one point to the other, right to the last mile. And of course, planning. Planning is always an element that cannot be overemphasized. So therefore, successful immunization programs are built on a functional end-to-end supply chain and logistics system. You cannot stop halfway to say that, oh, we have achieved something. The ultimate goal, of course, being to ensure uninterrupted availability of quality vaccines from the manufacturer to the service delivery levels, so that whenever there is an opportunity to vaccinate, it is not hampered by a lack of vaccines being available at the point of need. Next slide, please. I just recall here the very well-known rights of supply chain management. You can see from right product, right to the right cost. So in central functional role, therefore, or issues for strengthening the immunization chain will be funding, just to recap, quality, safety and efficacy, management of strong public reactions. Even in the time of Jenner, I can tell you that there were public outcries about these issues. Today, it is a relevant issue. So we just have to learn from those experiences and then move forward. Then, of course, the logistics issues which I have referred to. Next slide, please. So for want of time, I just want now to focus particularly on the contemporary challenges which we face in the public health supply chain, with specific emphasis on vaccines. Despite the success of routine immunization over the centuries, national vaccine supply chains are now strained, in my view, to effectively manage because of one, new surge in the introduction of vaccines. So vaccine teams at national level need to adapt to accommodate those vaccines. Then they have to also conform to new delivery strategies, technological advances. These advances take place at different rates in different countries, but because we live in a global environment, you have to find a way to balance the inequities that exist from one country to the other. This is also a challenge. Now, for instance, we have COVID-19 on our hand. We have to deal with availability of finance. Others have to deal with logistics of delivery, etc., etc. And then, of course, our health systems, our health services are putting more pressure to increase our performance, because nobody wants anybody to die for want of immunization. So that's additional pressure. And a very important thing which I have seen is that over the last couple of years, maybe 5, 6 years, I see that the interface between public health, which is the domain of immunization, and politics is becoming very blurred. By that I mean people who should have the technical freedom to take decisions often have to rely on political oversight. And when this is not in conformance with what science says, then we have a problem. I think the lessons of COVID-19 bear this in a very, very strong way. So we have to really find a way how we can balance public health needs through the science, and then political needs because of the constituents that have to be satisfied. And then, of course, in this age of the internet, whereas 20 years ago, 30 years ago, beneficiaries did not have access to a variety of information, today they can just, with a click of a mouse, go to so many sources of information of varying quality, and their judgment, therefore, is based on that lack of consistency. So this is a challenge which we have to deal with as we move forward with strengthening immunization change. People say, oh, the COVID-19 is meant to, so COVID-19 is meant to destroy some other race or something like that. This is all what they read from the internet. It's not what they are told by their health providers. So we have to manage that process of the internet. And then finally, I think the pressures also on our political leaders is creating a sort of panic. Here in Sierra Leone, for example, when we had the COVID-19, even before the supply chain was engaged, government was so concerned that they moved ahead to other ventilators. And by the time the information came to the supply chain and we started querying, why ventilators? How have we known that ventilators are working? In fact, it was found that ventilators are not, for us in Sierra Leone, that was not a priority. But we did invest some amount upfront in an area where we could have probably avoided if we didn't panic. So with that, I just wanted to end this brief presentation to say that we really have to ensure that we protect the gains of the past. Do not panic, because there is always some residual capacity which you can latch on. But if we panic, we ignore those infrastructures, and then it takes us back to square one. So I want to thank you very much for the opportunity of creating this partnership with Empower. Thank you. Over to you.
Can I? Thank you very much, Professor Sise. Just one thing I would like to remind our listeners about the advice you've given, not to throw out the baby with the bathwater. Let us always remove the baby before we throw out the bathwater. In other words, when it comes to this emergency situation, let us think that we've got good systems already established. We should not just ignore them and start panicking all over as if we are faced with something new which we've never done before. So that's a very good advice, I think, which we ought to bear in mind always. Thank you very much again. Now we'll go on to our next presenter, Dr. Tom Sise, Program Manager and current Incident Manager of polio situation. He is the technical lead and the health strengthening with the Ministry of Health and Sanitation. Dr. Sise is he has been a district medical officer and is currently for the child health and immunization program. So over to you, Dr. Tom Sise. Dr. Sise, unfortunately, you cannot see him. He's a small man, quantitatively, but qualitatively is massive. He's such a very hard worker and dependable worker that it could always be commended. Thank you very much, Dr. Sise. Over to you. Dr. Sise, are you there?
Tell Paul to
unmute.
Well, sorry
to unmute him.
Sure.
Or can you unmute Dr. Sise, Tom Sise?
Hello.
Yeah, team, can you do the same?
I'm so sorry, Tom Sise, I could not find him. I think somebody left. Amara, you can please check.
Call him alone outside.
We are sorry for the big, just trying to make some adjustments.
Can't talk to the lady unmute Dr. Sise.
Dr. Sise,
Check if he's still there online.
Hello, Rahul.
Dr. Amara, team is saying that.
Can someone unmute Dr. Tom Sise?
Let's see him first.
No, we are just checking whether he's there.
Okay, then I suggest I present and we come back to Dr. Tese.
Okay, he's there.
He's there.
Let's see. I think I see something like Tom. Okay, now Tom Jones.
Well, let's
Call the boss and they're online.
Okay, then I can present first and then.
Yes, I think that will be okay.
Yep, okay.
We could go see, please.
Professor, you could proceed.
Yep.
That's somebody to introduce, Prof.
That's okay. I can introduce me. I'm so old that everybody knows me. Okay. So I'm Prof. Andy Barraclough. I am Professor of Public Health and Director of Training at the Empower School of Health. I've been involved in supply chain management for over 30 years, and I'm one of the original co-authors of the Yellow Book, Managing Drug Supply from MSH and World Health Organization, which I know many of you will be familiar with. I've worked in most parts of Africa over many years, but I'm based in Southeast Asia these days. Next slide, please. When we look at COVID-19 vaccine planning, there are excellent guidance documents. There's the overall guidance document from WHO on developing a national deployment plan. And Sierra Leone has already developed a national deployment plan. Just released from World Health Organization is the COVID-19 supply and logistics guidance. This is a detailed document with lots of really good information on the vaccine, storage temperatures, what the packed vaccine volume is for the different vaccines. Very useful information available there. And of course, there is the standard WHO, how to calculate vaccine volumes and cold chain capacity requirements. These are available online. The links are on screen. They're heavy documents. The National Development Plan is 89 pages, and the logistics is over 80 pages as well. Next slide, please. Oh, why do you need all this planning, all these 90-page documents? We've been doing vaccine programs for years. Sierra Leone's had a multi-year vaccination program all worked out already. We have the know-how. We know how to do vaccination programs. We've been doing it really well. Next slide, please. So what's so special about this COVID vaccine? And the main thing that's so special is the scale of the operation required. And that's really where we bring the focus. Most EPI programs, that's the extended program on immunization, are focused on newborns and infants, crudely 0 to 1 years. And that's about 3.5% of the population. For COVID-19, the targets are to reach 30% of the population in the first year. Further, on the newborn programs, the babies are being produced every day throughout the year. For 30% of the population for Sierra Leone, I need over 2 million vaccinations tomorrow, please. So the scale of the operation is 10 times larger than we've been used to on the EPI programs. A lot of the knowledge from EPI is needed for the COVID programs. It's going to be used, but let's understand the key difference is the scale of the program we need to undertake. Next slide, please. Well, how can I plan anything? I don't know what vaccines are coming. I don't know when they're coming. I don't know what type of vaccine is coming. Probably we're going to get multiple vaccines. I don't know what storage conditions they need. They're probably different ones for the different vaccines. I don't know what the volumes and the transport is, and I don't know the cost. How can I possibly plan anything? And my message to you is failing to plan is planning to fail. Next slide, please. Psm planning is not only possible, but it's essential. You can prepare a list of information. You can undertake strategic decisions. Are you going to use in-house transport, or are you going to contract transport? You can prepare plans, templates, and budgets with unit costs, and you can start PSM staff training and awareness. You must prepare, because if you're not prepared, you will not receive the Colvax vaccine supply. A condition is that you are prepared, and there is a tool to measure your readiness to receive the COVID vaccine. I'll just stop for a moment and consult with Rahul. Do you wish me to stop and go back to the earlier presentation?
I think you can continue. I'm writing it to Dr. Tom to say that okay. He might present later on.
Okay, then next slide, please. which vaccines are out there? Well, there is a list updated twice a week. The link is on the screen. Last week, there were 242 vaccines in development. In January, there were 291. So vaccines are dropping out of the development all the time. Why are there so many vaccines in development? Because typically, when you develop a new vaccine, only 7% of vaccine candidates get through the laboratory and animal trials. They never make it to clinical trials. Of those that make it to human clinical trials, only about 20% succeed. So you've got 20% of 7%. On average, only about 1.5% of vaccine candidates succeed. So when you hear people talking about the vaccine development is being rushed, understand, you're looking at the winners. No one's talking about the 300 vaccines that went in the bin because they didn't meet the requirements. A massive, massive global effort has gone on. This list that's on the screen goes from many pages in Excel. 10 vaccines are already in use. And we'll talk about those in just a moment. Next slide, please. There are 4 main kinds of vaccine. Many of you will already be familiar with the vaccine based on the whole virus system, typically the polio vaccine, which uses an inactivated virus. That's the approach being developed by some of the Chinese companies in developing their vaccine. The viral vector, which uses a harmless virus to deliver a piece of code to produce proteins from the virus, the COVID virus, is probably the main candidate, and that's being used by Astrazeneca and the Sputnik 5. The more complex RNA nucleic acid vaccine, which is Moderna and Pfizer, delivers a piece of messenger RNA only for a small part of the virus into the cell, which then produces that protein and helps develop antibodies in the body. That's a particularly complex virus. It uses lipid nanoparticles to keep the RNA in place, but it does require very cold temperatures. And finally, there is the protein subunit, which uses a piece of the vaccine, a little protein from the outside, the corona spike, again in a lipid envelope to deliver into the cell. If we look at the different viruses under development, in the green there, we can see the non-replicating virus vector is the most common. That's the most number of vaccines under development. Next slide, please. There are 10 vaccines known to be in use. 2 types have currently been approved by WHO, but many are approved by other countries. So there is the Pfizer biotech in 50 countries and approved by WHO, Moderna, the Russian Sputnik 5 or Sputnik V, the Oxford AstraZeneca, the ones built in India and the ones built in China. So there's quite a range already in use around the world. The link on the screen shows you which ones, and again, it's updated twice a week to find out what's happening on the latest vaccines. Next slide, please. How do the different vaccines compare? This is just a few extracts. There's more vaccines available. So generally speaking, the AstraZeneca vaccine can be kept in a normal vaccine refrigerator. That's 2 to 8 degrees. The Moderna is -20 degrees, so in the freezer. Again, not impossible for EPI programs, which have some frozen vaccines. The Pfizer biotech is at -70. So that really is a difficult one to handle. And the Sputnik 5 is also regular fridge temperatures. How effective are they? It varies between different ways of measuring the effectiveness. Next slide, please. Vaccine effectiveness. First, if we compare the COVID vaccines with other vaccines. On the left of the screen, we look at seasonal flu vaccines, which are generally between around 40 and 60%. It changes year by year, depending on how the vaccine is formulated for that particular year and which new strains of influenza develop. In contrast, the COVID-19 vaccines in the middle are generally in the 60 to 95% range. The WHO specification for a COVID vaccine is it must be more than 50%. Make the point, you don't need a 95% vaccine for COVID. A 50% vaccine will work as a public health measure. On a personal level, you might well want the 95%, but even a 50% vaccine will have an influence on the pandemic, will reduce the rate of infection in countries. As it happens, the main candidates are already well above that. But if we compare that with the MMR vaccines and the polio vaccines at 97 and 99%, so we get some idea where the COVID vaccines are in the range of effectiveness, the range of efficiencies. And again, these are available online. The links are on the screen. Next slide, please. What's the cost? These are indicative prices. The actual price, of course, depends on the volume of vaccine you buy and whether you can get it at all. But we can see a tenfold difference in the vaccine prices from the Astrazeneca at around $4 to the Moderna coming close to $40. Prices in between. So there's a big price range on the vaccines. Again, these are only indicative prices for comparison. The actual purchase price will be different depending on the volume and all the other procurement conditions. Again, these prices are available online and are updated. Next slide, please. What is COVAX? COVAX is a coalition led by Gavi and the Coalition for Epidemic Preparedness Innovation, aiming to accelerate access to COVID-19 vaccines in a fair and equitable way. It's really in two parts. One part is called the SFP, self-funding participants. That is, countries, governments who are going to pay for the vaccines will buy them through the COVAX mechanism. Part two, COVAX AMC, the Advanced Market Commitment, is to supply 92 middle and lower income countries who perhaps can't afford COVID vaccines in order to enable equal access. This does not mean that 92 countries get vaccines for free. It does not mean that Sierra Leone gets vaccines for free. You discuss with the COVAX mechanism what they can do, how much. Some contribution is usually required, but it will be availability and it will be at reduced cost, not the full price. COVAX aims to get 20% of the population vaccine provision. Helps to manage the portfolio, and that means you've got a chance with all the big high-income countries, the USA and the European Union, trying to outbid each other to get vaccine. It's difficult to even get to talk to the manufacturer. COVAX provides the mechanism to do that. Next slide, please. How much vaccine are you going to get? Well, the interim distribution, that's the first distribution from COVAX to the low-income countries, has been published. The link is on the screen. You can see there for Sierra Leone, it's AMC, so that's the Advanced Market Commitment, that's the low-cost vaccine. It's 612,000 doses of AZ, Astrazeneca vaccine. It's SII, which is from the Serum Institute in India. Okay. I see we have countries from around the world with us today. I have only taken the extract of the S's, but the link will give you all the countries and the initial interim distribution. It doesn't mean you're guaranteed to receive this vaccine amount. You have to be on the preparedness list. Have you passed your preparedness test? Have you done your planning? Is everything ready and in place? Next slide, please. Where is the vaccine coming from? Well, for AstraZeneca, we have published information, so we can tell you most of it's coming out of the Serum Institute in India factory. That will supply most of Africa, so that's the blue that's producing it. It's going to Africa, the blue as well. AstraZeneca vaccine is being manufactured in a number of places around the world, including Australia and Canada, and will be distributed according to that geographic region where it's manufactured. Okay. It's the same vaccine, it's just manufactured in different plants because nobody has a plant big enough to make all the vaccine the world needs. The Serum Institute of India, SII, is the largest vaccine manufacturing capacity in the world. and they don't have enough capacity on their own. The COVAX plan is to try and get 1.8 billion doses delivered to the low-income countries. In effect, they're targeting to provide you with 20% of the population, vaccine for 20% of the population within 2021. For Sierra Leone, if we take the population at 8 million, okay, we're looking at around 2 million. 2 million vaccinations to deliver within 2021. Next slide, please. Vaccine characteristics. Well, most of the known vaccines will require 2 doses. The difference, one is Johnson & Johnson Janssen vaccine, which is a single-dose vaccine, but most will require 2 doses. That means you will need 2 sets of syringes and needles per patient. Sounds a bit obvious, doesn't it? Japan just dumped millions of doses of COVID vaccine because they got the wrong syringes. They couldn't use the vaccine properly. Failing to plan is planning to fail. It sounds simple, it sounds straightforward. All the information there about bundling, about what you need to use, is in the WHO guidance documents. Please read them, please get ready for them. Well, if you're going to have 2 million doses of vaccine, what are you going to do with all the used needles and syringes? You're going to need sharps boxes, you're going to need a disposal mechanism. You have to plan how you're going to dispose of all the sharps and all the contaminated material. You need to plan now for the administration and the disposal of the products. Next slide, please. Although most countries have developed a COVID-19 vaccine deployment plan, it's often deficient on the supply chain. So as supply chain people, you need to advocate for supply chain to ensure that supply chain planning and implementation takes place. It's not enough that you know what to do. You are operating vaccine programs. More than 70% of you replied in the poll that you're already involved with vaccine programs. It's not enough to know what to do. You must insist it happens. And that means advocating for supply chain, moving that forward. Next slide, please. Implementing a COVID-19 vaccine program is a massive undertaking. It's essential that planning is done at all levels, right down to grassroots, right down to the vaccination clinic and implementation center. The situation is fluid and changing rapidly. It's essential to stay up to date. Good information is available from the COVAX facility online. If you want to know more, there is a free online training course from Empower and Go On, which is the Global Outbreak Alert and Response Network and WHO Southeast Asia. This course is focused on Southeast Asia because they paid to develop it. Next slide, please. There's the link for that course online. Although it's focused on Southeast Asia, it's open to everyone. You can follow the course if you wish, but it is a Southeast Asia focus. There is a module specifically for COVID-19 vaccine deployment. Next slide, please. Okay, that's me done. I'm sure we'll have lots of questions to come to shortly.
Thank you very much, Professor, for the excellent presentation, which kept us spellbound somehow. And thank you once more. Now we turn to Dr. Sisi, if he's available. Dr. Sisi, are you online? Are you with us? Dr. Tom Sisi?
Yeah, yes, I'm online. I'm online. Yes, I'm online.
Okay, please, could you now come in?
Yeah, thank you very much. Yeah, so I'm Dr. Tom Sise. I'm the program manager for the Child Health and Immunization Program in the Ministry of Health and Sanitation. I'm just looking at the profile that is posted. It seems a bit old because I left Gambia district quite some time ago. But notwithstanding, I'm now the program manager for immunization, and I can go ahead and make my presentation. Okay, let's go. Okay, next slide. So basically, we just talk about a little bit about supply chain and logistics, immunization supply chain, and then the needs determination, orders, making orders, vaccine storage, and then a short highlight on considerations for COVID-19 vaccine. Because we have not started administering the COVID-19 vaccines yet, so we do not have too much to say about that. So next slide. So I'm sure all of you are conversant with these issues because that is what you do. The fact that logistics management is the part of supply chain management that deals with planning, implementation, and control for the efficient, effective, about goods, services, and related information between the point of origin and the point of consumption, you know, of, in this case, of course, we are talking of vaccines. Then supply chain management is much broader, dealing with the planning, management of all activities involved in sourcing and procurement, conversion of all logistics management activities. And it also includes the coordination and collaboration with partners to ensure that supplies reach the beneficiaries, you know, at the right time and in the right condition. Next slide. So in Sierra Leone, this is just a summary of not only in Sierra Leone, but I think across the world, of the immunization supply chain system. And I think I'll just run through this cycle, starting at the health facility level where vaccination happens, records have to be taken, adequate documentation of vaccines, vaccine use, and that information gets sent to the district level where, and then from the district level to the national level. Of course, at the district national level, at all levels, actually, adequate analysis of data has to be done to be able to know exactly the quantities of supplies that are actually required. And that would inform the request for additional supplies. At the national level, of course, we do procurement in collaboration with the support of UNICEF. And then, of course, we get the vaccines from the manufacturers, and then they are stored at the central cold stores. From there, distribution happens to the various levels onto the facility level and even at the community level when we do outreach services. So basically, that is a summary of the supply chain system that we have in our country. Next slide. Of course, of extreme importance is to know exactly the quantities that are required, you know, at all levels. And therefore, most of the health workers providing immunization services, and even the district staff, and then the national staff, you know, always have to be adequately trained and understand the various methods that are used to estimate needs. And then the most common is for us, we use the target population. Of course, we also have to know, incorporate information about the number of doses for the particular vaccine, and then the coverage target that is required for that vaccine, as well as the wastage rate, which include both open vial and closed vial wastage, because for vaccines, the wastage information is extremely important to be recorded. And that is where sometimes we find it difficult to harmonize between vaccines and other medical products because of this kind of the detail of information that is actually required. And of course, needs can also be assessed based on consumption patterns. That is also sometimes used, and in our case, and then of course, based on the size of vaccination sessions, but that is not usually commonly used in Sierra Leone. Next slide. Of course, we have, for monitoring of vaccine stocks at the national and the district level, we have a tool that is referred to as the stock management tool, which our staff, of course, this process is led by the program pharmacist, you know, at the national level, and then of course the district people have also been trained. So data is entered into that tool, and it helps to be able to, for the team to be able to know exactly the number of months of stock that are available and when vaccine orders will be done, so that we can avoid issues of stock out and issues of overstocking. We are also considering, we are now coming on board into the use of the RIV, which is a web-based platform, which is part of the district DHIS. that is the health management information system in this country. This is relatively new for now because we have not been using the RIV before. RIVs were mainly used just for other medicines, but now we are trying to bring vaccines on board. So we are in discussion at least to ensure that the information that we also require for vaccines can be incorporated in the RIV, and that would require some adjustments in the RIV template so that vaccines can be accommodated. Most of the vaccine distribution is based on pool system, based on requests from the district level and requests from the health facility level. And that is what usually informs distribution. Vaccine storage is very important and therefore positioned in an optimal distribution pattern to ensure that access to vaccination sites is easy, and not distribution not being skewed to favor certain populations. At the facility level, they document vaccine use in stock ledgers, and they do a request using requisition books. And that is basically the manual system that we've been using for a very long time, which has served us very well. But now we want to go a step further to ensure that we have a web-based system, which is the RIV, to document vaccine use. Next slide. So this is, of course, this is an illustration that I believe all of us are aware of. And this is something that we always try to train our staff on to ensure that they are aware of the reorder level when they are supposed to do the order for vaccines, and taking into consideration the lead time so that they will not utilize the safety stock. And with that kind of guidance and knowledge, vaccine teams, vaccinators, or in charges of health facilities, or the vaccine managers at the district level are able to order on time and ensure that they always have a buffer stock, or safety stock that prevents stock out of vaccines. Next slide. So vaccines can only be effective if they are administered in the right conditions, because at the end of the day, vaccines are not potent at the time they are administered. Then they will just be inflicting pain on the innocent beneficiaries, whether it's children, mostly children in our case. So this is just an illustration of the storage requirements. You can see that the OPV vaccines are usually stored in freezing conditions at the national and district level. Of course, the liquid vaccines are usually kept at 2 to 8 degrees at all levels, although the lyophilized vaccines can also be kept in those same conditions. So this guides us, our staff across the health facilities, across the districts, the national level, to ensure that vaccines are stored in the right conditions, before distribution. Next slide. And also, we also train our health facility staff on how vaccines are stored, within the refrigerator, to ensure that vaccines that are freeze sensitive, for example, are not put in areas where they can be frozen. So you can see the illustration of those that are freeze sensitive are usually kept away from the freezing areas. But at the same time, you have labels for vaccines that are to be used first, either because they are due for expiry, or maybe the vials have been opened. That determines that they should be used first before the other vaccines. So next slide. So just like I said, we'll just give some few considerations from COVID-19 vaccines. As has been explained by Professor Andy, we have developed the COVID-19 deployment plan, and fortunately, we are one of the countries whose plan have been approved. And we'll be getting our vaccines to the Kovax facility, as has been indicated. We're getting 612,000 doses, but incidentally, that will only provide for like 3%, or thereabouts of the population. And probably those people we are targeting, like people are above 70 years of age, and then of course the healthcare workers, to be the first set of people that will benefit from those vaccines. But we are also pursuing bilateral negotiations with other countries. China, for example, I think is offering some vaccines. And I think South Africa, maybe, possibly we may get some vaccines from there as well. So we are keeping our options open to ensure that we are able to vaccinate. For a start, we are targeting 20% of the population, but later on, we want to expand to other members of the population, because like for us to get herd immunity, we may need to have a very good proportion of our population vaccinated. So considerations for our selection of vaccine candidates include the safety of the vaccine. We have to ensure that our vaccines are registered, and approved by the pharmacy board, which will review all the documents and give us, the assurance that the vaccines are safe and efficacious. And of course, the cold chain requirements also is a consideration, because that is the reason why a lot of sub-Saharan countries have gone for the Astrazeneca vaccine, because of the cold chain requirements. But of course, we are trying to see how we can improve on our ultra cold chain storage capacities, so that we can be able to also store vaccines that require those storage conditions. Of course, we all know that the mRNA vaccines, such as the Pfizer, Moderna, they require much cooler storage conditions, and therefore they are not a preferred option. Whilst for the AstraZeneca and the Johnson & Johnson, at least our existing cold chain storage capacity will be able to use that to keep those vaccines and use those vaccines. So they are the preferred option that we have in Sierra Leone. So next slide. So like I said, we are still looking out for options to ensure that we can build on that cold chain capacity. And that is very important, because in fact, the meeting that I'm to attend now, we are discussing about the response to the Ebola virus outbreak. And most likely the vaccine candidates may require ultra cold chain storage capacity. So it's very important for us to have those capacities built in country. So I think that's the end of my short presentation. Thank you very much, colleagues, for listening. Joyce Calon, who is the program pharmacist, is there. I'm sure she'll be able to respond to issues, because I have to join an emergency meeting at the moment, on Ebola outbreak response. Thank you very much.
Thank you so much, Dr. Tom Sese. It was wonderful hearing you and Professor Andy. It was quite informative, and every participant I could see the chat full of various questions, as well as, they are excited to hear you and look about the, the learnings they had with the presentation from you and Dr. Tom Sese. So now the other part, the announcement of the scholarship part from Empower. As I said, we have already partnered with PSSL, and I am happy to announce the partnership and the scholarship today. Next slide, please. And I will also be sharing the process of how a person can apply for a scholarship. There is one full fee exempted scholarship, and there are 5 partial scholarship for the members of PSSL. So I would like everyone to pay attention so that they can apply for this scholarship, as this is a very good time for everyone to be learning a lot about PSM. Next slide, please. So in order to apply for the scholarship, you have to go to the website of PSSL. The link is below. Once you click that link, you will be taken to Empower School of Health webpage, wherein each and every course of Empower is listed, and specifically our postgraduate diploma course in procurement and supply chain management. Next slide, please. So in terms of the scholarship fees, the original tuition fee for our postgraduate diploma in global health procurement and supply chain is USD $2,500. But once you win the full scholarship, all fee is exempted. And for the partial scholarships, which are 5 in number at present, we offer a $100,
apologies everyone. Rahul, somehow he lost his connection. Professor Andy, if you can just take it further from here.
Okay, I can take some questions perhaps. Oh, I go through with the scholarship. If we go to the, okay, so there's one free scholarship. There are 5 with $1,000 paid, so you only pay 1,500. Next slide, please. Sorry, Sonia, can we go? Okay, yeah. So the process, you've got the link on the screen of applying for the scholarship. A brief CV, please don't send us 10 pages, just 1 page CV and how this course will help your career structure. Please email to Empower School of Health. They will be reviewed by Empower and PSSL, and then the selected applicants will be informed of the registration process. All the details are available at the link on the screen, and yes, all the slides will be shared with you. Next slide, please. Poll number 3, if we can pull the poll up, please, and I'd ask you please to take part in this poll. Okay, so for question 3, introduced in your country, for Sierra Leone, not yet, but I see that we have a total of around 11 countries on our webinar today, so maybe different countries have different ideas. Okay, how are we doing on the poll? Okay. Okay, there we go. Can we ask you to poll now, please? Question 1, immunization campaigns. Then on to, are you involved in the COVID response in your country? And then finally, how did you find this webinar, if it was useful or not? Okay, we have over 100 people voted already. So quite a lot have been involved in immunization campaigns, and we see a lot of participation on COVID, that's good. And of course, for the majority of countries, COVID vaccine has not been introduced yet, and we are pleased that you liked the webinar content. We'll just go up to the 2-minute mark and then we'll stop. Okay, let's stop the poll there, please. Okay. Excellent. Okay, so overall, we have an experienced group with us today, which is one reason I went so fast through the slides on that, and we're pleased that you found the webinar useful. Okay, back to you, Rahul, then.
Thank you, Professor Andy. I'm so sorry I lost my internet connection in between due to a power failure. So I think we are done with the poll. So can we move on to the next slide, please? Yeah, so now I will request everyone, there is a certificate of participation to the people who have attended the webinar. We are posting, a link. I'll request my team members to post the link for the, so here it is on the chat. There's a link for the certificate. You can just click on this put in your registrations, you put in your details, copy the link, save it for even applying. You have to just give us the details about yourself, and your webinar is on the way to your email ID. You have to just provide an email ID for the participation of this webinar. I hope everyone is doing that. We will just give 2 minutes, 5 minutes, maybe probably for people to register on the website link which is there. I'm again posting it so that people can just click on the link. There is a form which needs to be filled in, and they will get their email ID. They will get their certificate on their email ID. So people, please do that. That's good for your to get the CPD certificate.
Okay, if we're waiting, I can try and answer some of the questions we received on the chat.
Yes, that will be great.
Okay. One of the questions is, why does it take so long for WHO approval? Well, in fact, it doesn't. WHO can only start to approve a vaccine when the manufacturer applies for it. In order to apply, they have to have completed and published phase 3 trials. A number of vaccines are in use without the phase 3 trials having been published. So until those trials are published, the process with WHO cannot start. And it's up to the manufacturer to apply to WHO for their registration. So quite a lot of countries are using vaccines before phase 3 trials have been published. They're using it on preliminary data from phase 3 trials. How can you be sure about the safety of the vaccine? Well, if it's WHO approved, you know it's safe. People often ask, the vaccine process has been rushed, we can't be sure. This is the wrong question. The vaccine process has not been rushed. The normal vaccine process takes so long because most of the time we're waiting. We're not doing the trials. We're trying to get the money to do the trials. We complete phase 1, we write the grant application, and anyone who's ever written a Global Fund grant application will know how many kilos of paper are involved. You send it in, it comes back with queries, you send it in, it comes back. Months, years are wasted going backwards and forwards. For COVID, none of that happened. The money went in upfront straight away. Just by comparison, to develop the malaria vaccine took 32 years and $700 million. For COVID vaccine, the US government alone put in $7 billion in 1 year. And that's why the development process went so fast. There was no time waiting for grant applications. Okay, when will the demands be met by the manufacturers? The best estimate is 2024 before countries get all the vaccine they want. The COVAX mechanism gives you a route to get some of the vaccine, which otherwise many countries would not be able to obtain, even high-income countries. Low population countries like Singapore would never be able to get the vaccine if it wasn't for the COVAX mechanism. So it provides a route, but of course, everybody wants all the vaccine now. It's not available and it won't be for some years. Okay. Safety and effectiveness comparisons of the vaccines. Again, people misunderstand the effectiveness. Whilst on a personal level, you might want 95% effectiveness, we don't need that for public health programs. For COVID vaccine public health programs, anything above 50% works. And all the vaccines are above 50%. So I think there's a lot too much emphasis put on the relatively efficiency of the vaccines. Raoul, have people had enough time or do I continue?
Professor Andy, I think you have already replied to most of the questions which are asked, and I'm sure as per our data analytics, already 90 people have downloaded the certificate. They have been emailed the certificate and people are applying for it. Anyone who is left over can copy this link, copy the application process which I have put in on the chat. They can read it, apply it. That's not a problem from our side. Yeah, we are done. Over to Dr. Amara Bengali for the closing remarks.
Yeah, thank you very much, Rahul. The Secretary General, the President, Dr. Mutala Sise, will give the closing remarks on behalf of the Pharmaceutical Society to close this. Please, over to you, sir.
You could do the closing. Do the closing.
Okay. Well, needless to say, this has been really an eye-opener. And as you heard from the Deputy Chief Medical Officer representing government here, this is a unique event, and we should use the opportunity to benefit from that political will which has been established. On our side here, I'm very hopeful that we will pursue what we have committed to. And from the background of Empower, there is no reason why you cannot deliver your commitment, because you obviously have the wherewithal to do so. So with that, I want to thank Empower and to wish you all the best in your own programs generally. And we look forward to the partnership to grow from strength to strength beyond just the pharmaceutical profession, because we saw the need clearly for other health professionals to participate in this opportunity. With that, I really want to thank you very much, and for all the work, especially to my colleagues locally here, the Secretary General, Eugene Conte, Dr. Eugene Conte, Amara Bengali, Dr. Bengali, and of course the EPI pharmacist is here with us, Miss Joyce Kalon, and to a demonstration of the support we have across the board. And finally, of course, Professor Gage has been really dramatic. I'm happy that there are people like you still around, and I hope you can infect as many people as possible with your commitment, because you have, since we contacted you, even in your yes, and busy schedule, you have always been here before us. So we look forward to your continued support to this team. I want to hand over to you to see the last one.
Yeah, thank you very much, Alaji. We call him Alaji. And participants, colleagues, and friends, all those who took their time off to listen to this presentation, I thank you all for your commitment, and know that we'll get the requisite support from you. It has been a wonderful occasion, and as I said, this is the first experience I'm having for medical professionals in Thailand. I hope the other professionals, doctors, nurses, will in a way come up with similar adventure like this. Thank you all. 2 points I am taking away with me today, and which I would like you, among all the others, to bear in mind secretly. Is the first one: don't throw away the baby with the bathwater. That is, those structures which have proved very reliable and workable, maintain them in place and strengthen them. Secondly, the point hammered on by Professor Andy Barclough, that is planning. If we fail to plan, we are planning to fail. And I think that was stressed by Dr. Sise in a way too. We have to plan. We have to plan, otherwise we'll get lost in the maze of things. We have to plan and keep to our plans very seriously. So thank you very much, one and all, and I wish you all the best. Thank you.
Thank you. Cambo is a different.
Yes, thank you very much, Professor Gage.
Thank you,
Rahul, Professor Andy, all the panelists, all participants. Thank you all for joining. That's it from our end.
Yeah, thank you, Dr. Amara. Thank you, President Murtada Sese sir, and all the esteemed participants who have been patient enough to hear us, and hope you have enjoyed the session. And also the partnership will definitely grow on, and our commitment is there with PSSL. We will do everything and anything to ensure to strengthen the pharmacy profession in the country, and therefore the partnership will carry on with various such events in future. We look forward for another webinar, say in another 3 months or 6 months of time, whenever PSSL agrees, we will take another topic and we'll do that. And so in terms of my last words, I would request the participants to apply for the scholarship. The process is there in the chat, and we look forward for more, forms and applications for the scholarships. Thank you, and thank you so much, everyone.